Changemakers are Irish university researchers who are helping to shape our future with groundbreaking projects. They're committed to finding solutions to society's most complex challenges by working closely with some of the people who will benefit most. Welcome to Changemakers. Irish university changemakers are helping shape the future of medicine. From the use of robots to interactive applications, from high-tech medical devices to augmented reality, Irish patients are now interacting with technologies that are helping to improve lives. In Trinity College Dublin, we meet changemaker Claire Gillan, who is marrying big data technology with citizen science in a smartphone app that tracks behaviour and compulsion in real time. In NUI Galway, a team led by changemaker Derek O'Keefe is designing medical devices that are helping to change the lives of his patients. Recent research shows that Ireland has one of the highest rates of mental health conditions in Europe. It is estimated that nearly 20% of our population has experienced some form of mental health episode. In European terms, that accounts for nearly 84 million people. Changemaker Claire Gillan is based at the world-renowned Global Brain Health Institute at Trinity College Dublin.
What we're trying to do at GBHI, or one of the goals, is understand, what puts someone at risk for a disorder of the mind and how we can give people back the tools to mitigate that risk themselves.
Claire's lab is combining the latest app technology with citizen science in order to track behaviour in real time. Working with the players of Monaghan Rugby Club, she hopes to get a clearer picture of habits and behaviour, both from an individual and group level.
My lab is interested in using data science to better understand the brain, why we behave the way we do, and what complex interactions exist between our genetics, our environment, and certain psychological states. We hope that by leveraging this powerful technology, we can improve how we treat people who suffer from disorders of the mind, but also improve the brain health of the population at large. So there's basically a lot of decision points that one has to make in determining...
Claire and her team at the Gillan lab are looking at how our behaviour and mood can be related to brain health, and how our behaviour is then linked to more chronic conditions, such as compulsive behaviour and addiction.
And to make sure that the data transfer there is done...
What we're looking at is how people get stuck in episodes of illness, where it seems like all the mental health experiences that they have, their stress, their anxiety, their sleep, are actually reinforcing one another over time. And we think of that as being an acute state of mental illness. And that these network models can really help us understand the unique form that takes for different individuals.
Celine Fox is one of the team who is working on the NEUREKA phone app that combines citizen science with big data technology.
Users of NUIG can complete lots of different science challenges, and one of the challenges we've developed is called Pattern-Wise, and Pattern-Wise allows people to track any problematic behaviours that they have. So for example, if you feel bothered by the amount of food you're eating, or your gambling behaviour, your smoking, drug taking, nail biting, any kind of behaviour, you can track that behaviour over time and see what the triggers are for that behaviour and what's causing it.
It's pre-season at Monaghan Rugby Club, and Celine has come to introduce some of the team to Pattern-Wise.
We're going to show the guys how to download NUIG, and then within NUIG we have a feature called Pattern-Wise, and Pattern-Wise allows you to track your habits. So all of the guys are going to pick a habit that they're interested in seeing change over time, and they'll track that for 6 weeks.
So I suppose it's tracking compulsive disorders, I suppose. One that I'd be focusing on is probably how much you're using your phone.
You used to leave the house without your shoes, but now you don't leave without your phone. Probably don't bother with computers or anything. It's all done through your phone, and your phone's in your pocket, your phone's on your kitchen table, your phone's beside your bed. It's everything nowadays.
I suppose the boys, we all left off in a kind of disappointing time last year because we were doing so well through the season, but COVID obviously stopped it short. From being out here 3-4 times a week, then completely stopping, it was hard on both physically and mentally. But you had to truck through it, and I suppose this new app that we've been looking at will help highlight the more mental side of things, because everyone kind of would think more on the physical, but I think the mental side was more strenuous over the COVID period.
When someone downloads NUIG, they automatically become a citizen scientist. And that means that they're really helping us to understand brain health, but also to solve the big mysteries in brain science. So there's a lot of value not only to us by collecting people's data, but also to people who use the app themselves. And every time they complete PatternWise, a graph of their data is updated so they can see those changes in their own habits over time.
From the demonstration you can see that there's questions to be asked and you have to answer them. So it's going to make you think about your answers, and it is only 3 times a day. So hopefully as time goes on you'll see the trends change personally, and the study will hopefully learn something from it too.
Back at Trinity, Brian Penny is approaching the end of his doctoral studies. He is an important consultant of NEUREKA, and he brings a valuable real-life insight to the studies.
I was a heroin addict for 15 years. It was a compulsive, addictive behaviour. And for me, anxiety is what drove my addiction, and what drove those compulsive behaviours, what drove me to use. And I'm really interested in the work that Claire is doing here, because they're looking at the bi-directional relationship of emotional pain, emotional discomfort, and how that can drive compulsive behaviour.
That are just using information that we gathered from people at baseline to actually, that could aid in a clinical decision. So something, the data you could provide in one day, and that might tell a clinician something really about what we should do for this person. So the app is a game changer in moving away from population or group level findings right down to individual findings. We can build individualized pictures, and then we can also take groups of people together who are all, who are all tracking their nail biting, or who are all tracking their gambling, and see if there's just fundamental differences in how those networks look depending on what the behaviour is.
So for me, academically, in terms of my own PhD work here in Trinity, and in terms of experientially of what I experienced, I'm just looking to contribute with Claire's work and to really get some insights myself, because it's fantastic work that's going to help a lot of people. And if I had tools like this when I was in addiction, it would have been a game changer for me.
6 weeks later, and Monaghan Rugby Club are away to local rivals Virginia in a tightly contested local derby. Claire is back to talk to Mark McCardle about the app, which now has over 300 active participants.
So one of the interesting things we're doing now is we're hoping that the sorts of data we've got from the lads can help us understand how clinical therapies work better. So we have a number of projects looking at these same kind of behaviours in PatternWise as people go through interventions. And the idea is that we can start to figure out what the active ingredients of those interventions are, understand why they work for some people but not for others.
It hasn't been a positive result for Monaghan, and the points this time go to Virginia.
A lot of people have chosen to track their phone use in the app, and one of the things that we're seeing in the early data is that there's really self-reinforcing feature to phone checking that isn't seen there in other sorts of compulsive behaviours. So when you check your phone, it's actually more likely to cause you to check it again the next time and again the next time.
I enjoy sort of technology and things like that, and that's what sort of introduced me to the app at first. And at the start it took a wee bit of getting used to it, because it alerts you every 3 or 4 times a day. Like, I did see a result out of it. When you start to see that, you go, maybe it was worth putting that effort in for the time that it took. When you were tired, I tended to find that I was using the phone more just to pass time, whether it's early in the morning, late in the evening, or whether you've had a match and you're tired that next morning, you tend to look at the phone a bit more often.
But what's interesting about that as well is that that's not necessarily a pattern that everybody has, and you can see in this average of all the users so far, that's not there. That's where the advantage of having this personalised network to you comes into effect, right? Because for you, really, that link might be really important, and that's what we'd need to break, especially if it was a more serious compulsive behaviour than phone checking.
It only took me 5 minutes, not even, in the whole day to complete the questionnaires. And if that's as simple as it is, why not help? You could be helping your neighbour, your family, not even knowing it.
A unique partnership between NUI Galway and Galway University Hospital is helping patients find technological solutions to clinical problems. Derek O'Keefe is a physicianeer, a dual-qualified physician and engineer who trained in Ireland as well as in the United States at Harvard University and the Mayo Clinic. Derek and researchers at the HIVE lab in the Lamb Institute identify clinical needs and use state-of-the-art technology to develop innovative patient solutions.
So the secret sauce here is having other people with skills and strengths and passion in this area beyond what traditionally would be there. This is where we do all our exciting research with state-of-the-art technology such as AI, robotics, HoloLens, and lots of other novel solutions are developed here for clinical problems. So in the HIVE lab, we have computer programmers, we have electronic engineers, we have psychologists, we have educationalists. Everyone is at the table, all giving their skill set to make a solution that really works.
Hello, welcome to HIVE lab.
Dave is one piece of technology that is helping Derek and his team deliver care to his patients who suffer from diabetes, a chronically debilitating condition that can be life-changing for those who develop it.
Dave is the diabetes audiovisual educator, and it's an innovative idea. We're going to use robots to deliver healthcare information to patients. Diabetes is a significant burden on humanity. About 600 million people have diabetes. That's about 1 in 10 people. And in diabetes, the two main types are type 2 and type 1. Type 1 diabetes affects about 10% of people with diabetes, and it usually comes on earlier in life. It's an autoimmune condition. Type 2 diabetes is associated with older, middle-aged life and sedentary lifestyle.
Mark Cahill and his daughter Abigail from County Tipperary are regular visitors to Professor O'Keefe's clinic.
Abigail has type 1 diabetes for the last 10 years now, and she struggled like everyone does, trying to get the balance right between taking the carbohydrates in your food and calculating how much insulin you need.
Like the ability to fully understand what's going on. You arrive in hospital, you're told you have something. I didn't have any clue what I had. I was only 7 at the time, so everything affects diabetes, your mood, even just the weather. If it's hotter, you'll go lower. If it's colder, higher.
Type 1 diabetes is something you have to think about a lot. If you think about food, you go to a restaurant, you have to think about the food there. You eat at home, you have to weigh out or at least assess how many carbs are in a particular meal. We regularly visit this hospital, but we're meeting new technology. It's an interactive robot. We haven't met him before, so it'll be interesting to see what it's about.
Nice to see you, Abigail. Take a seat there. Nice to see you. Hi, nice to see you. Take a seat there, yeah.
Thanks very much.
Your annual review this year for hypoglycemia management, going through all the rules and so on, will be done by Dave rather than myself or by Helen. If you come over here, so. If you were to add up all the time that Abigail sees a clinician like myself or a nurse like Helen or the dietitian, the podiatrist in the whole year, it's probably only 8 hours, that physical contact with us.
Hello, I am Dave. Nice to meet you. Would you like to learn about diabetes disease and management?
Yes.
Yeah.
Yes.
Thank you. Let's get you started. Would you like to get seated?
So we want her to have the life skills to be able to manage diabetes without us. The technology that she wears and employs is part of that solution, but the bigger part of the solution is the education.
Would you like to learn about managing hypoglycemia, how to use glucometer?
We're very eager to find out, is that a good surrogate for a human teaching them? We're trying to bring in assistive technology into our practice that complements us rather than competes with us.
Another piece of important technology that is helping diabetes patients is being developed by the HIVE team.
We in the Diabetes Day Centre developed a mobile application that encompasses multimodal learning to teach carbohydrate counting in conjunction with the education they received with the dietitian. Basically, it helps to teach carbohydrate counting, and we're just looking to get some feedback from some of the patients here on how they like to use it.
Okay.
That'd be okay?
With Abigail and Mark, they're part of our PPI group, our Patient Public Involvement in Science group. And so they're actually at the table with the engineers, the psychologists, the educationalists, the programmers, the clinicians, they're all there with them.
And you just touch on each picture that you want to learn something more about.
Okay.
Nessa Keane works in diabetes and endocrinology, but she is also interested in harnessing the potential that digital medicine offers.
What excites me about digital medicine is we can offer patients more opportunities from a clinical point of view and from a patient care point of view than we could previously.
And is there a scoring system afterwards, or is it just to build your memory?
It's to build your memory, yeah.
Okay, yeah. Leaning on the technology gives us confidence. That confidence then, enables us to do things that you wouldn't normally do. I mean, as a parent, I'm growing my kids to be independent, and through these technologies it can help.
This technology definitely has been life-changing for just me, my parents, the whole family routine.
And ironically, it's changed us so that it's bringing us to normal, which is, what you want and what you want of your kids.
One of the HIVE Lab's most important collaborators is patient Sinead Hanrahan from Loughrea in County Galway, who has battled with the effects of diabetes since she was a young child.
When I was 12, I was diagnosed with type 1 diabetes, but as I got older, they realised that a lot of my family have the same type, and it was kind of rare that so many people in the one family would have it. So they actually diagnosed me with MODY. It's a mature onset of diabetes in the young, so it's kind of in between a type 1 and type 2. So I've had that now for almost 10 years.
Graduating from NUI Galway with a degree in nursing, Sinead became an emergency department nurse in Galway's University Hospital. But as the effects of her diabetes worsened, she lost the sight in her left eye.
In December of 2015, my right eye went fuzzy as well. Kind of in December when they said it would be a similar situation, I kind of knew for a while I knew before the surgery that it mightn't go to plan, and it didn't. So then I just woke up and they were kind of saying it didn't work, and I just said, am I blind? And they were like, yeah, and that was it.
You know where the steps are. No worries.
Sinead mentioned to me that she had recently now been fully registered as legally blind and was finding it difficult to navigate her world, especially being so young. She was quite active still and wanted to still engage in society. But an interesting thing she said to me was that she didn't like using the white cane. She said to me, we've had a white stick for hundreds of years. Surely with all the technology out there now, someone come up with a better solution for it.
When I first went blind, that was a big thing, was self-conscious, like, oh God, everyone's going to be looking at me, and I know they wouldn't, but in my head I was like, oh, they'll see the cane and they'll just be like, oh, the poor girl, and I just didn't want that,
And that planted the idea in my head then of developing this electronic device that would give you navigation feedback through haptic vibration, which started off as the Jedi glove and has now evolved into the HapNev.
Sinead is back in Galway to discuss the latest stage of the design. Local medical device designer Roisin Nolan has been collaborating with Sinead, along with engineer Musam Hussain, who helped develop the technology in the original glove.
Sinead is my inspiration. She's the person who needs this. So what we're trying to do is we're trying to make a wearable device that's user-friendly for Sinead. And I've gone out to Sinead's house and she was telling me, simple things like trying to go out and put recycling in the bins, and she's having to kick with her feet to kind of find where the bins are because she can't see them.
It's good to give a bit of input and change what works, I guess, for me and for any other visually impaired person that would be wearing the watch. So yeah, it went from the glove and then the HapNav. And it's just nice to try it on and tell her what feels good, what way to hold the hand, like what way I naturally hold my hand, and changes like that.
Oh, here you go. So Sinead is central to the design because she is the person whose needs we need to meet. And if we can meet her needs and make it useful, then it'll improve her quality of life. And that is the ultimate aim of what Professor Derek O'Keefe, myself and Musam are all working towards. We're trying to make people's lives better.
Over the following months, the HapNav collaborators have been busy integrating all of the necessary technologies into the latest design. The team are now back in Loughrea.
Ian has arrived from Dublin and he's been brilliant. He's designed the electronics, and we've miniaturized the device from the Jedi glove and we've made it into this small little wristwatch, so I can virtually see you because this is buzzing and telling me that there's an object in front of me. Hi Sinead.
The day has finally arrived for Sinead and the design team. If successful, the HapNav device could be an important step closer to Sinead's independence.
With electronics and software, you can do things that you just can't do with any other technology. It's the technology of sensing, and then the technology computing, and then the technology of feeding that back to the human.
When the HapNav device senses an obstacle, it emits a vibration, which gets stronger as it nears that object or surface, helping Sinead build up a spatial picture of what's around her.
I think I'm near them, but I just go a bit further.
There's a big intellectual input into this project, but also an emotional impact into this project, as you've seen from the design team. We've come with Sinead on this journey to design something that's useful to her in her day-to-day life, and the reaction today certainly is that it will be very useful for her. From here now, we want to bring this idea forward to the wider community of people with impaired vision, to let them use this straightforward device that's easily worn and used as part of their daily life.
Yeah. Yeah.
Good job.
That was brilliant. Oh, do you know, the feeling, literally the feeling for Sinead, to see her reaction there, to see it working, it just filled me up with, like, I'm just so pleased for her, because she was the one who said, Derek, I hate that cane, can you try something else? To actually have the thing come together today and Sinead using it, it just blows my mind. And now to see her actually go around the side of the house without having to touch it or use a cane and have this tiny little device on her wrist, and it's just like, it's just mind-blowing, it's brilliant. It's just fantastic to see it. And she's so pleased, that's the main thing, you know, she's so pleased. Ah, yeah. It's brilliant.
I feel like if I got a guide dog, hopefully that I could use both together. Because, you know, the guide dog would be at the left and this would help on the right as well. Well, it's something new, and I suppose it's like a step closer to a bit more independence. It's another aid to help me with my mobility, not to be relying on people all the time, and I can do my own thing.
Next time on Changemakers.
This is where all the magic happens, you know, all the work that kind of we're involved with.
It's like almost, if you look at it, like they're in a dark tunnel and they don't see any light out. And what try to do is just be that light, do you know what I mean?
The story exchange is about breaking down differences, breaking down barriers, sort of connecting over what makes us human.
Some people just end up here for one act or something silly that they do in life.